3 years have passed since the signing of the peace agreements that ended more than 20 years of civil war between the north and the south of Sudan, the biggest country on the African continent. The conflict led to 2 million deaths and forced millions of others to flee into the interior or neighboring countries and brought the population to its knees. It is currently one of the poorest in the world. Although the end of the fighting in southern Sudan has led to a certain stability, the humanitarian situation has not improved. The health indicators are alarming. Malnutrition is a chronic problem, and mortality rates for both children and pregnant women are high. Access to food, clean water, education, and health remain very limited. Adding to these difficulties are some tensions in areas still disputed by the North and the South, as well as tensions between different ethnic groups, which, given the considerable number of small arms in circulation, are still responsible for a significant number of casualties and weaken an already fragile political stability. Médecins Sans Frontières has been present in southern Sudan since 1983. Wars, famines, floods, epidemics. The humanitarian needs have always been vast, and this remains the case today. In Bor and Pibor in Jonglei State, MSF has built and rehabilitated several health facilities and reinforced them with health personnel and medicines. There, like elsewhere, the population remains vulnerable to diseases such as measles, cholera, meningitis, and malaria. Diseases which could be treated and prevented if access to basic health care was guaranteed, and which turn into epidemics and lead to human disasters when health infrastructures fail. Nearly 630,000 persons had to be vaccinated against meningitis in early 2007, when an epidemic broke out in 9 of the 10 states in the south of the country. In the same year, 2,400 patients were treated for cholera in the different MSF projects in the region. Tuberculosis, as contagious as it is deadly, is also widespread. Yet despite this alarming humanitarian situation, there is currently an appalling absence of aid actors in southern Sudan. The case of this young patient illustrates the situation well. Suffering from a severe skin infection, his family had to carry him on a stretcher, walking for 5 days to reach the only health post in the area, a post opened by MSF. He was then transferred to another medical facility by boat, where he was hospitalized.
Someone gets sick, if there's no one to help you carry them to an MSF structure, which are actually in this area, the only structures that are there, you stay in your tuku. If you recover, and if you don't, you die. Or you end up with consequences afterwards from the disease. It's a situation where there's really nothing. There's nothing, no health facilities. There's so little infrastructure here that is still a long way off. If we're not here, they really don't have anywhere to go. It's a very good thing to remain here as a primary healthcare project, to offer a population that doesn't have any access to healthcare, that they're coming from a war in a country that's not ready to cope yet to provide the healthcare that the population needs, and to be here when the emergencies happen, because they happen, and they've been happening every year, so we need to be here.
In this fragile environment in which infrastructures, roads, and the entirety of the health system have to be rebuilt from scratch, there is also considerable tension generated by the return home of hundreds of thousands of people, returnees who are looking to be reunited with their families and land, in some cases abandoned for decades, but who are also seeing the levels of assistance drop in the camps where they've lived until now. This is the case for the town of Bor, situated on the Nile, which has seen its population grow by more than 70,000 inhabitants, which represents more than a tenfold increase in 3 years' time. The public civilian hospital, supported by MSF, is the only medical facility in town, and looking further afield, in almost all of Jonglei State. As a result, Bor Hospital provides health services ranging from simple consultations to surgery. The needs are simply overwhelming, but also indicative of the level of persistent insecurity in the area. 4 out of 10 patients undergoing an operation here have suffered violent trauma, often a bullet wound.
Peace does not mean you don't hear any gunshot or gun sound. In fact, in South Sudan, you don't actually say that we have devolved, not at all. Or even you cannot say we have peace. It's not like during the war, but in fact, we don't see any development. There is no any construction has taken place. The same building that were there. The only little renovation is being done by NGOs, and some ministries of government are doing some renovation, like Ministry of Health. But like road construction, it's nothing.
Yet the pressing humanitarian needs are not sufficiently covered and are only exacerbated by the large-scale returns, which are often spontaneous and poorly managed. Worse still, international funding for emergency assistance has been gradually reduced and redirected toward the reconstruction and development programs, which, while necessary, are out of phase with the daily reality of people's lives.
The situation in Southern Sudan remains extremely worrying today. Despite the peace process, we are the beginning of a process rather than the end. The needs of the populations are extremely acute. Violence is still ongoing in many areas of Southern Sudan, with conflict between ethnic groups linking to social tension, but also with political manipulation behind it being very present. We are seeing a lot of trauma in our wards inside our medical structures. Now, all this is on top of a global humanitarian situation which is extremely complex, with returning populations, with growth of urban centres, and with very few actors and no medical infrastructures, no general infrastructures, in fact, in Southern Sudan. This leads to a complexity, high needs, and also still the problems that were faced in the war, which is difficult access due to the rains, very heavy logistics required, yet fewer actors which are providing this logistical support, making again the deployment and the capacity to answer the needs of today, the acute needs, extremely difficult. The MSF finds itself very much alone in most of the operational areas where we are present, and having to cope with much more needs than we would be comfortable with in other locations. We cannot be waiting tomorrow. Every day is another life lost in South Sudan. So the proportion of resources going to humanitarian aid needs to be maintained and increased to be able to face the needs of the populations in Southern Sudan today.
The population of Southern Sudan can no longer bear the brunt of inappropriate policies that put their health and lives in danger. It is urgent to respond to their needs without further delay.
You don't have to think about whether the need is there or not. Here, you don't have that question. The need is here and it's clear, there's no one else here. And you don't get a lot more remote than this place with as big a need as this place has. So I think it's clear that we need to be here.